is Eurecia. I'm going to be your nurse today. What is your name? Okay, when's your birthday? Okay, so I'm going to provide privacy. I'm going to wash my hands. Okay, and then I'm going to don on some gloves. And I'm going to tell the patient what we're going to do. Today, I'm going to remove and apply new dressing to your wound. So, I would first assess for pain, and if there is pain, I would administer medication 30 minutes before the procedure, and then I will place the patient in a comfortable position and in a position that I can actually change the dressing. Position the bed in a comfortable position to where I have easy access to the wound. And now, so I've already performed hand hygiene, I donned on gloves, and now I'm going to start by removing the dressing. I'm first going to lift the edges up, but before I do that, I'm going to stabilize the skin with my other hand. And can you see? Okay. With my other hand, I'm going to gently raise the edges until taut. Okay. And so I'm lifting all the edges up. And then I'm going to remove the this top dressing, and I'm going to put it in the biohazard bag. And then if this wound was sticking, if the dressing was sticking to the wound, then I would moisten it with normal saline. And then if there was more layers in this wound, so if there was more layers inside this wound, then I would continue to remove the layers until the entire dressing is removed. And then I would assess the type and the amount of drainage present on the soil dressing. And my patient doesn't have that many layers. So from here, I'm going to remove After I have disposed of my soiled gloves and soiled dressing in the biohazard waste, I am now going to start by pulling the corner of these 4x4 gauze. I'm going to pull the corner to open it. And then I'm going to moisten these gauze. So after I have opened this, I'm going to moisten the gauze with normal saline or filtered water. So I'm moistening it, and I'm going to don on new gloves. After I don on these gloves, I am going to gather a gauze pad, but I'm going to do it by pulling the corners, the 4 corners, to the center. So here I've gathered it, and now I'm going to use this I'm going to use the center to clean my wound. I'm going to start from the center. I'm going to start from the center of the wound and out. So I would start from the middle, and I'm going to wipe out. And I would dispose of it into the biohazard bag. And I would repeat it by picking up another gauze pad and wiping with each, lightly wiping a section. So after I clean this wound, I will assess it for location, amount of tissue present, exudate, and odor. And so I've cleaned the wound, and now I've disposed of my gauze in the biohazard waste, and I'm going to also dispose of my gloves in the biohazard, and I'm going to wash my hands. So now that we have removed the soil dressing and cleaned the wound, we are now going to apply a wet to damp dressing, And so here's my sterile field. We are going to need the gauze, sterile gauze, and the sterile surgery pad right here, and a cotton applicator to apply the dressing. So I will start by opening this sterile gauze. So what's inside here is sterile. So that's open. This is my sterile field here. And now I'm going to open this. So that's open. And then I'm going to moisten my gauze with normal saline or filtered water. And now I'm going to don on gloves. So here are my surgical gloves. Being careful to only touch the outside border. Okay, and now I am going to pick it up. I'm going to step back and I'm going to just apply that glove. So it kind of messed up, but that's okay. We will get that fixed. So now I'm going to pick this one up too, being careful to only touch the cuff and not the fingers. And I'm going to pick it up. I'm going to step back and I'm going to also just do the same thing. And so now to fix this, I am going to get my fingers in the right directions. And I'm going to pull down from the palm. Okay, so that's been fixed, and I'm going to do the same thing here. And then pull down. So my sterile gloves are on now. And so now I'm going to squeeze the excess moisture out. I'm going to squeeze the excess moisture out. And I'm going to apply a single layer of this gauze pad onto the wound. And I'm going to be careful to place the gauze and all the gauze and all the depressions and crevices of the wound. I will use a sterile forceps, or in my case here, I will be using a sterile cotton applicator. And I'm going to make sure that I get in the depressions here. So, if you can see, I'm going to get in all the depressions. And then, okay, so there's that. And then I'm going to grab another one and I'm going to put it over the first layer, repeating all the steps until the wound is completely filled with moistured gauze. But do not exceed the moist dressing onto the surrounding skin. Make sure it's not tight in there, but make sure you have all the depressions covered. Okay, so that has been in there. I'm going to dispose of this cotton applicator. And now I'm going to cover it with the surgery pad. The surgery pad we have here. I'm going to cover the wound with it. And then I'm going to secure it with dressing tape. So I have secured it with dressing tape. Now I'm going to dispose of my gloves. And I'm going to perform hand hygiene, and I'm going to date and time the dressing. And then I will assist the patient into a comfortable position and give them their call light.